Hello, hello, hello. My name is Esther, and I will be presenting you with human immunity. This presentation is generally about the human body and the way our body is able to fight infections and diseases, and then we add a bit of how the body is able to recognize its own cells from outside cells, and how we acquire immunity through vaccination, immunization, and natural immunity. So let's go. Okay, so these are the topics we're covering here. Like I just mentioned, we have first and second lines of defense with examples. The third line of defense, self-recognition. We have immune response to vaccination, concept of herd immunity, etc. So let's dive in. What is infection? Infection, like we know, refers to invasion of the body by harmful pathogens or harmful microorganisms. Some of the causes of infection includes bacteria, fungi, parasites, and viruses, and these causes varieties of infections. Here we see a picture, an image illustrating different types of infectious diseases that we have, like tuberculosis, cholera, meningitis, etc. Now, how does our body prevent or defend us from these infections? It does this by things we call the first and second line of defense, and the third line of defense. So we have three types of defense. Here we're looking at the first line of defense. What is the first line of defense? It is the first way that our body is able to prevent the infection from invading our body. The typical example is our skin. So our skin has a protective layer that is not conducive for viruses or for infections to go into. So they are the body's protective barrier between its internal environment from external invaders. They line up the surfaces of the eye, um, of the ear, nose, mouth, throat, respiratory tract, and many others. For example, the skin protects us from bacteria, just as I've mentioned. The first line of defense, this is a typical example of the first line of defense. We also have something called mucus, the mucosa, like your nose, when you sneeze, you get some mucus out of it. That's also a way by which our body is able to fight infection. Because when you watch it, when you're sneezing out something, some bacteria that prevents that, and that is a way your body stops it from actually going to your cells and causing more havocs. And through your mouth, through your gastrointestinal unit system, we have this mucus that lines up these places to help us to prevent infection, and we have our gorgeous skin, which helps us also from avoiding infection. Now we're going to dive into the second line of defense. What is the second line of defense? It is the second line, like it says after the first line. It is the second way that our body is able to fight or attack these viruses when it's been able to go through the first line of defense. So, for example, if the infection has been able to go through your body, through your skin, or through the mucus into your system, your body is able to fight it or defend itself through this line. Sometimes it causes you to have fever. You can begin to have things like inflammations, etc. Also, things like phagocytes or cytokines, some complement, some proteins in the body, go to that site of infection or whatever and destroys the cell, some inhibit it from growing, and all those good things that our body do, which is amazing. So inflammation, we can see a very beautiful picture showing us about inflammation, how the body is able to. So sometimes when we have an inflammation, it's not really a bad thing. It's also a way for us to know that our body is working and that our body is able to fight some infections. So for example, in this picture you can see a needle or a pin or a sharp object pierce the skin. What does it do? This immediately sends a signal to your immune systems, to the neutrophils, to the macrophages, and it's immediately sends, you see, it sends the white blood cells, phagocytes, to the place of infection. The phagocytes immediately engulfs it, and this is this picture just shows us the process of phagocytosis and how amazing it is, how it's up infections of viruses or bacteria that comes to disturb our peace. So now we're going to the third line of defense. Yes, you guessed it. What is this third line of defense? It is when your body has gone through the first stage, it's gone through the skin, it's caused you fever, it sent protein to the site of infection, and the infection continues to grow. What comes next is this third line of defense. The third line of defense is the internal way that our body fights against infections as usual. This occurs when the pathogen successfully navigates the first and second stages. Microbes known as pathogens can infect the organism and lead to diseases. So this third line of defense is where our immunity, our immune system comes into play. Our acquired or our acquired immunity, this is where it actually comes into play. So let's look at what our immunity is, what immune system is. According to Newman 2023, the immune system is the body's tool for preventing or limiting infection. Most people know our immune system as white blood cell, WBC. Okay, so we have 5 types of blood cell. We have neutrophil, lymphocyte, monocyte, eosinophils, basophils. Neutrophils are the most the largest in the blood cell, like 60% of it in your blood cell. And we have lymphocyte, which is second to that. Lymphocyte itself has 3 main types, and this includes B cells, T cells, and natural killers. Okay, lymphocytes are quite cool. They're very good. We have monocytes, which can change into dendrites cells or macrophages, which helps us to eat those things, eat those viruses and bacteria. We have eosinophils as well. Eosinophil is particularly, it helps to fight fungal infections or gastrointestinal type of infections. Basophils, which is very limited, we don't see it too much, but it's about 0.1% or 0.5% in the blood cell. Now we have this thing that is called immunoglobulins. They are also a type of antibodies. Okay, antibodies are a part of immunoglobulins, which actually helps us to recognize cells or to recognize something that is not cell. Okay, we have five types of immunoglobulins. We have IgG, IgM, IgA, IgE, IgD. IgG is a type of immunity that is being transferred from our mother to us when we are born. IgM is specialized in killing bacteria. IgA congregates in fluids like the mucus. It's mainly there, and when it's not there, it can cause you, this is where we have, like, sometimes we begin to get serious chest infections or lungs infections or things like that, because IgA is not there or it's low. IgE protects against parasites and plays a role in allergies. When a lot of IgE is there, you can begin to have things like hay fever. IgD bounds to lymphocytes, helping them to start the immune response. Okay, now we're looking at antigens and antibodies. We've looked at immunity and how the immune system helps us to fight infections. Now antigens itself, it's a molecule that alerts our body that something that is not itself, that is not self, is present. So, and it triggers immune response in which the immune system is instructed to either make an antibody for that virus. Okay, so it develops or to develop an immune resistance to it. Any substance, including proteins, carbohydrates, lipids, nucleic acids, can act as an antigen. So any virus can use either a protein or carbohydrate to attack your cell, using them as an antigen or say a sign to be able to attach to your cells. And our body, how does our body fight this? Our body produce things that are called antibodies. They are like proteins produced by B cells, B cell lymphocyte, which fight infection and neutralizes toxins. Okay, so self-recognition and tolerance. Antigens are, that its distinctive properties enables the immune system to differentiate between self and non-self. Okay, so allowing only the non-self to be targeted. When the immune system is good, it targets against non-self. For instance, antigens produced by Staphylococcus aureus differ from the one produced by your red blood cell. So also the immune system uses this MHC1 or MHC2 to recognize self from non-self. So if it is self, it's cool, it does not do anything. But if it is non-self, it goes into fragments and alerts it causes an immune response and tells it, okay, but it just attaches itself to the front of the cells, telling the immune system that, listen, something that is not cool, not something is not going right here. And this is how the immune system is able to recognize self from non-self. Okay, let's go. We also, I forgot to share that before going in here. Our body is able to recognize this thing, and it also reacts in different ways. So our body generally is sensitive. So when your body recognizes when something comes into your body, it's able to check, is this mine or not? And that is its sensitivity. Hypersensitivity, however, it can become hypersensitive, which where it just attacks something like dust or air or some food particles. It just attacks those things, which it shouldn't. So it's just abnormal. It's an abnormal immune response triggered by repeated exposure to the same antigen. So sometimes it just says, some people, you hear that people are allergic to nuts, allergic to dust or some things like that, and it's just the immune system responding or reacting weirdly, which it shouldn't be. And then we have a rejection of transplanted organs. We have autoimmunity and rejection of transplanted organ. We're going to treat autoimmunity next, but rejection of transplanted organ can be hyperacute, acute, or chronic. Hyperacute shows that it definitely there is no go-go. You should take out that organ or whatever transplant. It could be blood, it could be heart, it could be whatever. Your body does not accept it. And if it is there, the person can die within the next few hours. Acute it can take up to a week or months for it to actually come up, and you just need to take out that organ. Or chronic rejection, it might take years, which is not too bad, but it can take up to years. So these are different types of there are ways that your body reject, or shows that it does not accept, it doesn't marry this, it's not working. So now we're looking at autoimmune disease. What is autoimmune disease? Autoimmune disease is an abnormal way your body fights infection or fights its own cells. This is where your body starts attacking its own body cells. It's sad, unfortunately, but there are different types of autoimmune disease. This picture definitely illustrates different types of autoimmune disease. For this presentation, we'll be looking at Crohn's disease and diabetes. Okay, so what is Crohn's disease? Crohn's disease is an attack on the GI system, on the gastrointestinal system. It mostly measures on your colon or your small intestine. It does affect the whole GI system sometimes, but most times we find that it is more on the colon or the small intestine. What is Crohn's disease? It's an inflammatory autoimmune disease that affects the GI system and mostly attacks the small and large intestines. There are no known treatment because it is, there is no known treatment yet, but most times surgery is recommended. Symptoms may include diarrhea, bloody stool, cramps, and different types. Yeah, okay, cramps, stomach cramps, fever, constant feeling, and constant feeling to use the toilet. Even after you've gone to the toilet, you still want to go, and nothing is coming out. Causes not known yet. However, studies have shown that one's immune system, genes, environment can play a vital role in the development of this disease. Diagnosis is done after series of blood tests, stool tests, endoscopy, colonoscopy, and different scans, CT or MRI scan, that helps the doctor to detect which part of the body or where is this disease measured most in your body. Okay, so now we're looking at diabetes. Type 1 diabetes. It's another autoimmune disease. This picture just shows you different symptoms that one can have. Someone with type 1 diabetes, if you're feeling these symptoms, I hope you're not, but there is some frequent urination, excessive thirst, extreme hunger, extreme fatigue, blurred vision, sudden weight loss, irritability. These are some symptoms that is attached to type 1 diabetes. Now let's look at what it is. Type 1 diabetes is an autoimmune disease where insulin producing cells are attacked. So it's something to do with your pancreas. Symptoms, we've looked at it. Causes, this is an autoimmune disease where the pancreas are destroyed or damaged. The cause is not known yet, but can be linked to genetic issues or problems with your pancreas. Diagnosis. This can include blood tests to help measure the level of the sugar in the blood. Other tests include glycated hemoglobin test. I have no idea if I pronounced that right. It is used to measure your blood sugar within the past 2 to 3 months. Okay, or you can measure your sugar within 2 to 3 months. And then fasting and random blood sugar test just to check how high it is. For the treatment, doctors recommend insulin. Okay, and then a lifestyle change to improve your lifestyle. Yes, we're looking at acquired immunity now. We this acquired immunity is it's just a way of telling us that we don't have any immunity at birth. We have no immunity at birth. We just have this passive immunity that we get from our mother, but our immune system is not exposed to anything, so it doesn't know how to fight it. So as we get exposed to different infections, different viruses, different types of pathogens, our body is able to develop this immunity. So there are different types of immunity. There's passive, there's active. There's naturally passive immunity, which we get from the placenta or through breast milk. There's artificial, which is injected. You know, as soon as a child is born, they have these different types of immunization. Okay, and then active immunity is when we're exposed to the virus. For example, exposing a child exposed to chicken pox, you develop this immunity to it, which is quite cool. and an active immunity, an active artificial immunity is an exposure and a vaccination. When a person is vaccinated, you've artificially received an active immunity. So how does our body respond to vaccination? Speaking of vaccination, what is vaccination? It is a process whereby the immune system is exposed to a less harmful version of a particular pathogen. Okay, it is mostly done through injection. When encountered by the immune system, the body releases antibodies in order to fight the disease. Vaccines can be administered as inactive or as live. Okay, when it's inactive, sometimes you need to be injected 2 or 3 times for it to be active. But when it is live, you're injected once, your body starts feeling it, or start responding to it. For example, an inactive type of vaccination would be Hep B, hepatitis virus. I think you have to get that injected 3 times for it to actually work. Actually, you get injected once, and you need to come back for the second dose for you to be able to be, properly immune to the hepatitis. Now we're looking at concept of herd immunity. Herd immunity is whereby the whole population is immune to some type of virus. So for this presentation, I'm going to be rounding up very quickly. Herd immunity, you are vaccinated, everyone is encouraged to be vaccinated. But when that everyone is now vaccinated, the virus can spread quickly. But when more people are vaccinated, it reduces the infection. Benefits of vaccines are so amazing and it saved our society so far. It actually helps people. It helps to reduce the virus from spreading, and we see this to be evident in the coronavirus vaccination. And this picture just shows us some factors that can affect vaccination in our society. Thank you for watching.